Hey everyone, this is the quiz for skin. Which physiological difference in pediatric skin increases the risk of systemic absorption of topical medications compared to adults? A. An immature immune system. B. A looser dermoepidermal junction. C. A thinner epidermal layer. D. A lower surface area to mass ratio. Okay, I think it's a thinner epidermal layer. Yeah, the stratum corneum is thinner in infants and children, providing a less effective barrier against the absorption of substances applied to the skin. Right. A nurse is assessing an infant with a severe diaper rash and notices bright red pinpoint satellite lesions. Which pathogen should the nurse suspect? A. Staphylococcus aureus. B. Candida albicans. C. Methicillin-resistant Staphylococcus aureus. D. Propionibacterium acnes. Okay, I think it's a yeast infection, so I'm going to go with B. Yeah. Satellite lesions are classic clinical manifestation of a secondary fungal infection complicating a routine diaper rash. When educating parents on the management of diaper dermatitis, why does the nurse advise against using cornstarch or talc powders? A. They interfere with the absorption of antifungal creams. B. They cause excessive drying of the healthy epidermis. C. They act as a potential source of aspiration. D. They promote the growth of bacterial pathogens. And I'm going to go with C. Powders contain fine particles that can be inhaled by the infant, leading to serious respiratory distress or chemical pneumonia. Which intervention is appropriate for a parent removing yellow crusty patches associated with seborrheic dermatitis cradle cap on an infant's scalp? A. Apply a topical corticosteroid twice daily to soften the crusts. B. Avoid washing the hair to prevent further irritation to the fontanelles. C. Scrub the scalp vigorously with an adolescent-strength tar shampoo. D. Use a fine-tooth comb after softening the patches with mineral oil. And I'm going to go with D. Softening the patches with oil and then using a soft brush or fine comb allows for gentle mechanical removal without damaging the underlying skin. The itch-scratch-inflammation cycle is a hallmark of which pediatric skin condition? A. Seborrheic dermatitis. B. Atopic dermatitis, eczema. C. Cellulitis. D. Acne vulgaris. I'm going to go with eczema. Okay. This condition involves a barrier defect and immunologic response where scratching further damages the skin, leading to more inflammation and itching. A nurse is teaching the family of a child with atopic dermatitis about skincare. Which of the following instructions should be included? A. Limit baths to once a week to prevent removal of natural skin oils. B. Bathe the child in hot water to open the pores before applying lotion. C. Apply thick emollients like Vaseline immediately after a short lukewarm bath. D. Use wool or polyester clothing to prevent skin moisture loss. I'm going to go with C. Applying a barrier while the skin is still moist helps trap the hydration in the stratum corneum. Why is periorbital cellulitis considered a clinical emergency in the pediatric population? A. The orbital venous system is valveless, allowing retrograde spread to the brain. B. It indicates the child has primary immunodeficiency that requires testing. C. It, it, it is usually caused by MRSA, which is resistant to all oral antibiotics. D. It can lead to permanent scarring of the facial structures. And I'm going to go with A. The lack of valves in the orbital veins allow infection to move backward into the central nervous system, risking meningitis or abscesses. An adolescent is prescribed oral isotretinoin for severe cystic acne. Which requirement of the iPledge program is most critical for a female patient? A. Weekly assessments for suicidal ideation. B. The use of 2 forms of effective contraception. C. Avoidance of oil-based cosmetics during the 6-month treatment period. D. Monthly liver function tests and lipid panels. And I'm going to go with B. Isotretinoin is highly teratogenic, I don't know how to say that, causing severe birth defects like spina bifida. Preventing pregnancy is primary goal of the iPledge program. A nurse is assessing a child with suspected cellulitis. Which finding would most strongly suggest the infection is spreading through the lymphatic system? A red streak tracking away from the edematous area, presence of purulent drainage at the site, a high-grade fever and systemic malaise, the skin feeling firm and wooden to the touch. I'm going to go with that one. Lymphangitis presents as red streaks following the path of lymphatic vessels, indicating the infection is moving beyond the initial site. In the context of pediatric skincare, what is the significance of a high surface area to mass ratio in infants? It leads to faster healing times for inflammatory conditions. It increases the risk of fluid loss and systemic toxicity from topicals. It decreases the risk of hypothermia during bathing. It makes the infant less susceptible to friction and blistering. Oh, I think it's this. Yeah. Because infants have more skin surface relative to their body weight, they lose more water through the skin and can absorb dangerous levels of medications applied topically. A nurse identifies disturbed body image as a priority nursing diagnosis for an adolescent with acne. Which outcome would best indicate the goal of treatment is being met? The adolescent refuses to look in the mirror until the skin is clear. The adolescent successfully completes a 4-month course of isotretinoin. The adolescent reports attending social events despite visible flares. The adolescent uses heavy oil-based cosmetics to cover all lesions. So it's either B or C. Okay, which outcome would best indicate the goal of treatment is being met? I mean, the goal of treatment would be to complete the treatment, I think. Okay, I'm gonna go with B. Engaging in normal social activities demonstrates that the adolescent's self-esteem and body image are not being detrimentally controlled by the skin condition. Okay, well that makes sense. When teaching parents about dental care, at what level of fluoride in the water supply is supplementation usually recommended for infants starting at 6 months? Oh, I have no idea. Exactly 1 ppm, 7 ppm, 3 ppm, only if the infant is exclusively breastfed. Mm, I don't think it's D because I think you can give a fluoride supplement for her if they're on formula. Um, I would say C. Okay. When water levels are below 0.3 parts per million, supplementation is needed to protect tooth enamel without causing stain. Okay. Which developmental milestone indicates that an infant is physiologically ready for the introduction of solid foods? The emergence of the first tooth at 6 months, tripling the birth weight, the ability to walk independently, loss of the extrusion reflex. Um, they're probably gonna eat solid. Oh, I don't know. Um, I think it's, well, I don't know if it's this because when you feed a baby like baby food, is baby food a solid food? It's not, it's pureed. It's not solid. Uh, because when babies eat solid, I mean baby food, they have still the extrusion reflex, I think, because it's like they use their tongue to push it out. Mm, I don't know the answer to this. I'm just gonna go with D. The extrusion reflex causes infants to push food out of their mouths with their tongues. Its disappearance allows them to swallow solids. Okay, so I guess um, the baby food is not considered solid, so they're eating that while they still have the extrusion reflex. I guess, I don't know. A parent asks about baby bottle syndrome. Which practice should the nurse identify as the primary cause of this condition? Um, Introducing solid foods before 4 months of age. Allowing the infant to chew the bottle nipple before teething or for teething relief. Putting the infant to sleep with a bottle containing milk or juice. Using a bottle with a nipple that has a very small hole. I think it's probably this. Yeah. The liquids pool around the teeth during sleep, allowing bacteria and to ferment the sugars and create enamel destroying acids. Okay. True or false? According to the source material, a healthy infant requires a full bath every day for optimal skin health. I think that's probably false. Overbathing can dry out an infant's skin. Daily baths are generally unnecessary for cleanliness. When teaching an adolescent about sun safety, what are the ABCs of screening for melanoma? Antibiotics, barriers, corticosteroids. Appearance, bleeding, color. Acne, blistering, cellulitis. Asymmetry, border irregularity, color regularly. And I'm pretty sure it's this. These features are key indicators that a mole should be professionally evaluated for potential skin cancer. What primary rationale for using nystatin for 3 days after a candida diaper rash has visibly cleared? A. To provide protective barrier against future moisture. B. Fungi can persist in the deeper layers of the skin even after the surface appears healed. C. To reduce the risk of systemic absorption of the medication. D. To prevent the development of antibiotic resistance. And I'm gonna go with B. Continuing treatment ensures that any remaining fungal spores are eliminated, preventing immediate recurrence. Which medication typically used for acne is contraindicated in adolescents with a history of depression due to the risk of suicidal ideation? A. Tetracycline antibiotics. B. Topical tretinoin. C. Benzoyl peroxide. D. Oral isotretinoin. Um, I think it's D. While its link to depression is debated, it's a clinical precaution to monitor avoid use in adolescents with significant psychiatric history. In the management of seborrheic dermatitis for adolescents, which shampoo ingredients are recommended if standard baby shampoo is ineffective? A. Selenium sulfide or salicylic acid, Selsun Blue. B. Alcohol-based cleansers. C. Zinc oxide and aquaphor. D. Topical hydrocortisone inhibitor. And I'm pretty sure that it's Selsun Blue. Yeah. These ingredients help reduce yeast overgrowth and loosen the waxy scales associated with dandruff and teeth. A nurse is creating a plan of care for an infant with cradle cap. What is the first step in the mechanical removal of yellow patches? A. Leave emollient-sleek mineral oil on the scalp for 20 minutes. B. Apply a topical corticosteroid to the scalp. C. Vigorously scrub the scalp with a coarse washcloth. D. Use an alcohol-based wipe to dissolve greasy scales. Sorry, I'm tired. I'm gonna go with A. Allowing the emollient to sit softens the crusty patches, making them easier to remove with a brush or comb later. Which statement by a parent indicates a correct understanding of washing an infant's head to prevent seborrhea? Seborrhea? Anyway. I must use a medicated tar shampoo for every wash from birth. I will gently wash my baby's scalp every day or every other day. I should only wash the scalp once a month to protect the soft spot. If a rash develops, I should stop washing the area entirely. Okay, I'm gonna go with this. Frequent gentle washing helps prevent the buildup of sebaceous secretions that lead to cradle cap. A nurse is evaluating a child with atopic dermatitis. Which finding indicates the condition is chronic rather than acute? Fever and red streaks tracking away from the site. B. Dark, thickened skin, lichenification and scaling. C. Presence of red weeping lesions with exudate. Clusters of pinpoint reddened papules on the neck. I don't know the answer to this. I think this is not right. And this this I also think is not right. I think I don't know about, it's either B or C. Atopic dermatitis. I don't know that red weeping lesions would show that it was chronic. I think this would show that it was chronic because it's like a thickening of the skin would happen like over time. Yeah. Chronic scratching and inflammation lead to lichenification, where the skin becomes leathery and darker in appearance. Okay. Why does the nurse advise that oral antihistamines like Benadryl or Atarax be given at bedtime for a child with atopic dermatitis? They are only effective when the body is in a resting state. Antihistamines are known to cause hyperactivity in most children. They must be given on an empty stomach for better absorption. Itching is often worse at night, and sedation helps promote sleep. I'm gonna go with D. Eczema-related itching tends to intensify at night, leading to sleep disruption. Antihistamines help the child stay asleep and avoid scratching. A nurse is teaching an adolescent about potential triggers for acne flares. Which of the following should be mentioned? The menstrual cycle and oil-based cosmetics, washing the face more than 3 times a day, eating chocolate and greasy potato chips, drinking fluoridated water from the tap. Potential triggers for acne. Well, I think it's either A or C. I think I'm gonna go with A. Because A, the menstrual cycle is hormonal, and oil-based cosmetics are can clog your pores. So I'm gonna go there. Yeah. Hormonal shifts during cycle can increase sebum, and oil-based products can worsen follicular obstruction. Okay. Which diagnostic test is most appropriate to identify the specific pathogen in a case of cellulitis with drainage? A. Skin scraping for microscopic exam. B. CBC. C. Bacterial culture. D. Computed tomography. Um, I think if it's draining, we want to do a culture of like the drainage, maybe. Yeah, I think so. Yeah, culturing the drainage allows for identification of the bacteria, for example, staph or strep, and determines antibiotic sensitivity. Um, an infant with special needs is unable to reach out to a caregiver. Which nursing intervention best supports the development of a sense of trust? I don't know why this is in the skin, but okay. A. Limit the amount. Oh, sorry, guys. Limit the amount of physical touch to prevent equipment displacement. Explain that children with cognitive differences do not develop trust. Point out the positive cues the infant can do, like eyes following the caregiver. Encourage the parents to focus entirely on the medical equipment. The only one that doesn't sound wrong is C, so I'm just gonna go with that. Helping caregivers recognize subtle communication builds their confidence and strengthens the bonds, fostering trust in the environment. Okay. Again, not sure why that's included in skin, but whatever. In the Blueprint Step 1 assessment, why is it important for the nurse to perform an environmental scan for a child with a skin disorder? A. To investigate potential triggers such as detergents, fabric, or pets. B. To check if the child has received all routine vaccinations. C. To determine the family's ability to afford medications. D. Evaluate the home's water fluoride levels. I'm going to go with A. Identifying environmental irritants or allergens is crucial for managing conditions like eczema and preventing flares. And we're done. Yay, 96%. Awesome.